Hello and a warm welcome to the programme from me, David Foster. How to help others when you need help yourself. It's a dilemma facing charities worldwide. Well, donations have plummeted and some may well be brought down by the coronavirus itself, the effects of which have yet to be fully understood. This is Roundtable. You know, saving lives doesn't just happen in hospitals. Charities, well, they have always offered hope in apparently hopeless situations. Now that may well be changing.
Charities in many countries are facing a bleak future due to the impact of coronavirus. In the UK, there are warnings that charities will miss out on at least $5.3 billion of income over just a few months, though the figure could be far higher. One survey revealed that 43% of the charities have seen an increase in demand for their services, coupled with a 48% decline in voluntary income. Thousands of charity shops were closed and fundraising opportunities cancelled to prevent the spread of the virus, leading to more lost income. The annual London Marathon is a record-breaking event which raised more than $81 million last year, but that too was scrapped. As charities adapt their service and business models to the changing environment, how will COVID-19 shape the future of the charity sector?
And I'm very pleased to welcome Ellie Dawes, Fundraising and Communications Manager at child.org from London. She'll explain what that does. Martin Caraher with us too, Professor of Health Policy at City University of London. And we say hello to Heidi Travis, Chief Exec at Ryder, the British Palliative, Neurological and Bereavement Support Charity. It's based in London, but she joins us from Milton Keynes. Thanks, everyone. For joining us on this programme. Heidi, let me come to you first of all. One of the better known charities in the UK. You would not expect Ryder to be hit immediately by all of this, but you're feeling the effects right now, correct?
I think we did feel the effects straight away, and that's largely because of how our funding works, which is we get approximately 30% of our funding through the NHS from the government, and that means we have to raise the other 70% of funds. And that comes from our shops and from our fundraising activities. And of course, as soon as lockdown was formally announced, we closed all of our shops, that's 470 shops across the UK, and all of our fundraising activity had to cease. So we had a real immediate and urgent need to work out how we were going to sustain ourselves through having lost 70% of our income.
And that's £1 million a month. In terms of a shortfall, is that right?
Well, actually, when we closed the shops and stopped our fundraising, it was over £6 million a month that meant that was going to impact us by. And of course, as soon as some of the announcements started to be made in terms of the furlough arrangements and indeed the potential for government support, it was really for us working through what that was really going to mean in the short term, what that was going to mean from March onwards for the first 3 or 4 months. And I think it's fair to say we're still in that place where we're still every week trying to understand what the longer term picture for us means, because there's no certainties in terms of how shops might trade again or fundraising might come back.
Yeah, I mean, I thought it was $1 million. If it's much more than that, that's devastating for you. But it's there we're talking numbers, but it's people who are feeling the effects of this. Those people you try to help.
Yeah. And I think this is what this always comes back to: is it is about the people. And I'm hopeful that this is going to really help to engage and trigger a future conversation about the funding, because over the last 8 years, charitable funding for palliative care has gone down from about 60% to the 30% that it is today. And yet the palliative services that hospices provide are part of the UK's end-of-life service delivery. They're not something that sits separate to what happens within the NHS. And I think this has been a real wake-up call across the system for people recognising that charities are having to generate such a significant proportion of funds to be able to continue to run those services. And it is a really big number, and charities will only be sat on so much in terms of reserves. And when you're looking at not trying to make a profit every year, which charities are not trying to do, you are trying to put all of your money into looking after people, and that's what we're interested in doing. We're interested in spending our money delivering services.
Okay, Heidi, let's go to Ellie, and I want to read you, Ellie, something from Carl Wilding, who's head of the National Council of Voluntary Organisations. He says, every day counts here. I'm hearing from charities whose income has disappeared overnight, but who still have to run services for their communities. Ellie, most of your work is done in East Africa, in Kenya. How has this affected you?
Lots of different ways it's affected our work as Child.org. Firstly, it's made a huge difference to our programs and our ability to run them in country. So our support groups that we run for vulnerable pregnant women have been put on hold, and that means that we're unable to reach those women in rural areas with vital health messages right at a time when that kind of messaging has suddenly become even more urgent. We need to reach women with important messages. We're seeing like really tragic preventable deaths of mums and babies on our programs because they don't know that they can break the government's imposed coronavirus curfew to seek medical attention when they're in labour. So they're having dangerous births at home, and we can't reach them through the normal channels. So we're having to adapt our programs very, very quickly. We're working with local taxi services. We've launched a text message system to try and reach those mums via text message. At the same time as doing that, and that stuff costs money and it requires investment and new infrastructure, our income has effectively vanished overnight. So
I think it's cut by 50% was what I was told. Are you getting any kind of reasonable help, would you say, with this?
Well, our supporters have been amazing. Like, I just want to stress, like, the outpouring of support from our supporters has been incredible, and we've seen some like huge sacrifices and big donations from some of the people who really believe in the work that we do.
Sorry to butt in. I know you're thankful to your supporters, but your income's gone down by 50%. Have you had reasonable government support on this?
We haven't received government support. In fact, the government package for charities, my understanding of it, we looked at it when it came out, was that it's not actually very useful for international organisations. The vast majority of it is focused on charities that are supporting at home with communities that are affected in the UK by the coronavirus. So effectively, like, a lot of that is sort of outsourcing the government's own response to coronavirus and protecting its citizens. It's not that there isn't the funds available for communities like ours where we're working with people in other countries and other levels of support as well, like just stuff like furlough. Like, we've hired a lot of our staff in Kenya, so we need some staff in the UK.
Yeah. I mean, let's not beat around the bush here. Ellie, you've described the government's response as shockingly inadequate.
Yeah, well, I think the numbers just tell you that it's shockingly inadequate. The charity sector in the UK has lost £4.3 billion of funding, and the government has offered £750 million. I think what sort of chilled us when we saw Rishi Sunak announce that support was that he described us as all needing the gentleness of charities in our lives. And I don't see my work as gentleness, and I don't recognise that as a way of describing the work that we do. We tackle difficult problems that are long-term and systemic, and we're smart, and we do challenging work that needs urgent funding. And to hear the government described us as something that like sounds like a nice to have and not something that sustains the very fabric of our society was quite chilling. And I think that was a moment that I and a lot of people in the sector sort of realised that help wasn't forthcoming. And I think there are a lot of factors in this country over the last few years, if you want to look at sort of cause and effect.
Can I come back to that? Do you mind if I come back to that? Because I haven't said hello properly to Martin on this one. Your area of expertise is food poverty. How are you getting help with making sure that people get the food they need if they can't afford it?
Well, with difficulty. I mean, food banks the numbers using food banks have quadrupled. It's gone from 1.25 million to nearly 5 million. These are people who are on the margins. And the food banks have been hit in the first stage of the crisis. I mean, they largely relied on donations of food, so donations dried up. But then volunteers dried up because a lot of their volunteers are in vulnerable groups, and social distancing caused problems. And the solution is that the government are going to give about £3,000 to each of the food charities. Now, this is inadequate. It was inadequate before the crisis. It's certainly inadequate in the middle of the crisis. So we've got 5 million people relying on food banks at the moment, and the government response has been paltry, to say the least.
Okay, Martin, we'll talk about your area of expertise, food poverty, in just a moment. But if there's a dearth of money generally, where can the government get its funds from, specifically to help the charity sector?
Well, in the short term, I mean, through universal credit. I mean, universal credit is the means to lift people out of poverty. In the long term, we could divert lottery monies to help the charity sector get over the next stages, like we've done with the Olympics when we insisted that the lottery divert money to physical activity issues. The new crisis with COVID means we've got to protect charities who are delivering services at below cost. If the government have to deliver these services, it's going to cost the government more in the long term.
Isn't there a certain irony here that NHS charities are doing relatively well, and they're normally funded by the lottery? So you'd be taking away lottery money from them because perhaps they don't need it and giving it to charities that might otherwise go under?
That's true, but in the area of public health, we need to put money into prevention. And a lot of the charities we're talking about are not just treatment, they're preventing. So they're preventing people getting to the NHS by living healthier lifestyles, giving them appropriate food, giving them skills, diverting them from issues such as drug use, which saves money in the long term. I mean, you've got to invest in the short term to save money in the long term.
Okay, Heidi, let me come to you, and then Ellie, I'll go back to you on this one as well. Vicky Browning, Chief Exec of what is known as the Association of Chief Executives of Voluntary Organisations, said that the voluntary sector cannot do what it does best if it's gone bust. Charities need swift, simple and substantial funding now. Where do they get it from?
I think we've obviously talked to the government, talked to the NHS about the funding of end-of-life services and palliative services. And I think the immediate need, particularly in the COVID crisis as we were journeying through March and April, for everybody was to make sure that the British public were going to be able to access palliative care services, that where more people were going to be dying than would be usual, that those services would continue to run. I think hospices at that point in time and still today are playing a critical role. So I think the government stepped forward and did give hospices funding, certainly to see it through the first quarter of this financial year. I think as we travel forward, we're going to continue to have that conversation about the fact that in a health crisis and with the virus still within the population, we need to make sure that people can access appropriate palliative care. They need to be able to access pain relief and the right level of support when they're going through some of the most difficult times that families can face.
See, I wonder, even if you've had to close your shops, your fundraising is down, if a charity such as Sue Ryder, so well established, so well respected, is actually in the fortunate position of not thinking it might go under, whereas other charities perhaps do.
I think every charity, very few of them would be sat on enough money to be able to continue to run their services for much more than a few months.
Are you saying the same applies to you?
And certainly we have to work really, really hard to make sure that we can travel through the rest of this year. When services are as expensive and costly as they are, and when you're only receiving normally 30% of the funding, that's a huge amount of money to find the 70% gap, and we normally do that with activity that we generate. But if that 70% has suddenly stopped, then those services are not going to be able to continue to be provided, and they are the United Kingdom's end-of-life services. Hospices do provide the end-of-life care. They're not an additional service in terms of end-of-life care for the British population.
I'll talk to you, if I may, about your bereavement services, which you say is fairly new, in just a short while. But Ellie, when you hear that from Heidi at the head of Sue Ryder, which has been around pretty much most of my life and is so well respected. When you hear that from the head of a very large charity, does it make you wonder what chances small charities such as yours have?
Well, absolutely. I don't think there are any safe charities. I mean, in my sector, we've just seen Oxfam have closed operations already in 18 countries. Like, I don't think any of us saw Oxfam pulling out of 18 countries, and they've lost 1,450 jobs already due to this crisis. I think charities don't have huge these huge reserves that they can just keep running their services day to day. For decades, the public and funders and the people who fund charities have demanded that we spend our money straight away. You know, it from the person donating on our website who wants 95% of their donation to be immediately spent in the field within a year, to the funder who wants to fund a specific project that starts within 6 months. That's how charities are funded, and that's how funders right from the government and the biggest grant givers down to the smallest donor have demanded that our organisations run.
You see, the thing that puzzles me, Ellie, is that there is so much money out there. People showing their generosity with the appeal for NHS charities, particularly through Captain now Sir Thomas More. Is there a certain bit of resentment, perhaps, that other charities are getting the money and yours and others aren't?
I think there's always less of that in the charity sector than anyone would expect. I think everybody wants to see all charities doing well, and the fact that the public is in a giving mood and feeling more motivated about feeling part of the community and wanting to be doing good is really good news for everyone. It's not Captain Tom walking around his garden that's cost Child.org their revenue. It's because we can't run a cycle ride across Kenya. That's not Captain Tom's fault, and it's not my neighbour who wants to donate to the NHS. The whole issue of charity sector being the way we do good in our society is that it depends on the whims of the general public in terms of what they feel like donating to at the time, and that's not always dictated by need, and it's not always dictated to by what the best magical thing would be to do if you had that giant pot of money. But that's why it as a sector is democratic, and we fund what people feel like funding at the time, and people get to do the good that they feel like doing in the world.
Let's talk about what people feel able to do at the moment. Ellie, you first. We've had to say goodbye to Martin, a few technical issues there. Ellie, you first. You say you can't arrange the cycle ride across Kenya, but people have all sorts of different ways of raising money and raising awareness at the moment. Think of a couple to do with your group.
Well, there's a lot of volunteering opportunities out there to do remote volunteering. One of the things that we're seeing people do some really innovative fundraising models. So we've had people doing stay at home, but like decorate their whole room a different colour every day and get sponsored to do that kind of stuff. And the nice thing about fundraising is it really brings joy to your network and the people that you're communicating with. So I would urge the public to have a look at some of those opportunities. We're doing online supper clubs, which are really lovely and make you feel like you've been out for dinner with some interesting people. We've got some great stuff on our website. But also I would urge you to just sort of write to your MP. I think this is a time when we as a society need to look around and decide what we as a society can afford to lose after this and what we want to keep hold of. Is it Oxfam or is it EasyJet? You know, like what's important to you? What like wider are your strategic aims and priorities for your society, and let your MP know those and demonstrate those with your fundraising and your donations.
So we have to reorder our values. I suppose if you have an online dinner party, you don't have to clear up after 14 people. So it's not such a bad thing. Heidi, what are your supporters doing?
Our supporters have been brilliant. We launched an emergency appeal and they've been incredibly generous. That's both members of the public and trusts have stepped forward to support us. I think they've recognised that people were dying not only of COVID but continuing to require palliative care, and they wanted to make sure that those services were there. And I think people were also very generously wanted to make sure that we could continue to support people in their grief through the bereavement services. So we've had lots of innovative things happening, virtual quizzes, virtual pub quizzes, which has brought out the competitive side, I think, in lots of people. And people have just been very, very generous and very giving to us in terms of wanting to help support what we do.
I was looking at a website called the Centre for Charity Effectiveness at one of the London universities, and they have a podcast called Good Charity, Bad Charity. Now, I'm wondering, and this is going to be very difficult, I suppose, for some people who know that they're actually trying their very best to do something, but are there ways to run a charity these days that will mean the good ones will survive through this, and the ones that are not run so effectively will go under, and that won't be such a bad thing, Heidi?
I'm not sure it's as simple as that. I think if you'll have some very small charities out there who are being very well run, trying very hard, but if their income stream has just vanished overnight because all fundraising activity has stopped, or any small amount of income streams that they were getting are not coming in, they're just simply not going to be able to be delivering the charitable ask that is there for them. So I think charities do need to be really well run. I think they need to be well governanced and well led. And I think that has taken place a lot more over the last 20 years in terms of charities having to demonstrate that they do things really well. Of course, with that alone brings a cost with it. So in terms of providing very good accounts, managing risk assessments, good data control, all of those things I think cost money to deliver. But I think that it is right that charities demonstrate that they do spend the funds that people give them in the very best way.
Ellie, have you had to think again about how your organisation's run?
Yeah, what's been really particularly heartbreaking for us at Child.org is we're a very small and very innovative, fast growth charity. And what we've really invested in is raising money through enterprise and diversifying our income. And it's actually charities like ours who have done all the things that we've been told to do by the charity sector, who are, we want to raise our money, but through enterprise. We don't want to be asking people for donations forever. We want to create more sustainable ways of funding our work. And that's the stuff that's really disappeared. So I think it's my opinion that all charities are extremely well run and efficient by and large. They're more efficient than companies because they have to be. They meet higher standards. But unfortunately, it's those kind of innovative funding streams that we've seen disappear, which has been the thing that's really heartbreaking. But hopefully it's the innovative and agile and fast-moving small teams like ours who will be able to find new opportunities and act fast and recover some of that lost revenue. And that's what we're working really hard to do at the moment.
Before we have to say goodbye, give a plug for child.org and in 15 seconds, try and sum up for those people interested in helping what it is you actually do out in Kenya with children.
So Child.org fund innovative health interventions in Kenya. So at the moment, our work is mostly with young mums who are cut off and isolated and need health information, the kind of stuff that you would get at your NCT class that really can just save lives. Information like what are the signs that you need to go to a hospital when you're pregnant. We just tell women that stuff. And it's simple, innovative, brilliant work, and we work really hard to make it as effective as possible. So do visit our website. It's child.org. It's the same as our name of our charity. We've got lots of cool stuff that you can do it now from home.
Great. Heidi, at the beginning of the programme, Ellie talked about the fact she felt the government's aid package was shockingly inadequate. I didn't ask for your response. I will now. And then I want to ask you about your bereavement counselling. Is it appalling what the government is doing in terms of the sum of the money?
I think the hospice sector put together a really clear paper in terms of what it required to be able to continue to provide the services, and I think the government stepped up to fund that, certainly for the 3 months alongside the furlough schemes that are in operation. We're continuing the conversation with government about what's going to happen for the rest of the year, because shops are probably not going to return to trading as they were before that quickly, and fundraising will take time to step back up. And
I have to hurry you a little bit, I'm sorry. And the bereavement service, because as you point out, this is a time in our lives when people and families, individuals, whatever, will experience grief like we have never done, on a scale that we never have done in our lifetimes.
Yeah. People shouldn't feel frightened about needing bereavement support if they're feeling devastated by grief, particularly in this time when perhaps they haven't been able to hold people's hands or give people a hug. Go along to our online support services. We have live video counselling that people can book sessions for. We also have an online community where you will get peer-to-peer support with over 10,000 people a month using it. Don't sit and suffer your grief alone. Please go on and use the services. sueryder.com/support.
Well, listen, thank you both very much indeed. I wanted to say thank you to Martin. We lost him because of technical problems, but he was going to make the point about food banks and how difficult it is for people at the moment, homeless people, people who have no income, difficulty for them in getting income support, etc., etc., etc. There are so many people out there. We didn't give Martin the chance. He didn't have the chance, rather. But there are so many people out there who could benefit so much from the work that you, Ellie, and you, Heidi, are doing, that it is such a shame that the sector is under such enormous pressure at this time. We hope we've managed to get the message out there to some degree. Appreciate you coming on the program, and good luck with everything you're doing as you take your work forward. Thank you. That's Ellie from child.org and Heidi Travis from Sue Ryder. From me, David Foster, my thanks to them, my thanks to you for watching, and we hope to have your company on Roundtable next time. Until then, goodbye.